and welcome to COVID Quickly, a Scientific American podcast series.
This is your fast-track update on the COVID pandemic. We bring you up to speed on the science behind the most urgent questions about the virus and demystify the research and help you understand what it really means.
I'm Tanya Lewis.
I'm Josh.
And we're Scientific American's senior health editors. This is our back-to-school special episode. We'll talk about why COVID testing is about to become a school problem.
And then there's some good news about kids' risk for long COVID. It's pretty low.
If you've got young kids, you've probably already started buying fresh notebooks and maybe a new backpack. It's back to school time. And you've probably bought into some worry, too.
Schools are large group settings, and group settings are good places for COVID outbreaks. Infectious subvariant BA.5 running around. You probably got alert letters last spring saying someone in your kid's class tested positive. And if your kid was a close contact, go get your child tested too.
Easy rapid testing is a good way to contain outbreaks. And we all want to keep kids and teachers safe and keep schools open.
True, but we're beginning to see some problems coming up with this containment strategy. Let me start with Ashish Jha, the physician who's the White House COVID response coordinator. He got on Twitter this week to say he's ready to send his kids back to school, and he wanted to emphasize ways to do that safely. His first point was about vaccines. The shots lower infection rates in kids and do a great job at blocking serious illness. But this is problem number one. Children are not getting their shots. The fully vaccinated rate for kids aged 5 through 11 is just 30%. For kids under 5, who recently became eligible for shots, it's even worse. Just about 1%. Things look better for kids 12 through 17. Their vaccination rate jumps to 60%. But for those younger kids, the low rates mean a lot are showing up in school without the first and best line of defense.
So that raises the risk of outbreaks, doesn't it?
It does. And that brings up Jha's second point. The best way to keep spread low and reduce outbreaks is testing. And the U.S. government has, up to now, bought tens of millions of tests and made them available to the public. And those purchases created a market that encouraged companies to make even more tests. But that's going to change. Jha, the same guy pushing the importance of testing, told CNN that sometime in the fall, the government is going to stop buying these things and turn that over to the commercial sector. Not all at once, but in kind of a phased withdrawal.
You'll still be able to get tests, right?
Yeah, but less so at free clinics and more so at drugstores and doctor's offices, the regular medical system. A rapid antigen test kit sells retail for about $20 to $30. The more elaborate PCR test costs about $250. You'll have to find out if your insurance company will pay for them and submit a claim and then wait for reimbursement.
And probably get into an argument with the insurance company about how much they'll pay you, because that's how insurance works in this country.
Then, if you're one of the 26 million Americans who don't have health insurance, you'll be paying for the test yourself.
You'll still be able to get free tests at schools. The White House says it will supply 5 million rapid antigen tests and 5 million PCR tests to schools that request them. The school should give them to you.
But the shift to the regular healthcare system is going to make the testing landscape more complicated. With low childhood vaccination rates, you could be needing a bunch of tests and have to do more running around to get them. New Jersey just announced that unvaccinated school workers and workers in childcare no longer have to get tested routinely. And if other states follow suit, that'll make spotting outbreaks even tougher. So along with those new school notebooks and pencils, it might be a good idea to stock up on a bunch of COVID tests now, while they're still pretty easy to get. There's a lot of scary and conflicting info out there about long COVID, especially when it comes to children. What do the studies really show us?
Well, early in the pandemic, there was good reason to be worried. Some studies showed the risk of long COVID, lingering symptoms such as fatigue, depression, or headaches that continue weeks or months after an infection, could affect as many as 2 out of 3 children who had COVID.
That's a lot. Have those findings held up over time?
Well, more recent studies provide some reassurance that the risk of long COVID in kids is much lower. As SciAm contributor Shannon Hall reported this week, these studies had something many of the earlier studies lacked: a control group.
That seems like a pretty big shortcoming.
It is. When researchers compared the rate of long COVID symptoms in kids who had been infected to those who hadn't, they found few to no differences between the two groups. For example, a large study in the UK published last year found that most of the kids who had COVID felt better within 6 days, and more than 98% were fully recovered by 8 weeks. In contrast, kids who tested negative for COVID actually felt worse at the 4-week mark than those who tested positive.
That's not what I would expect.
Right. And a study earlier this year in Denmark, where school children were strongly encouraged to get tested for COVID twice a week, found that those who tested positive were slightly more likely than those who tested negative to report at least one long COVID symptom 2 months later. But the difference was small.
Were there any other problems with the study?
Well, one issue is that different agencies use different definitions for long COVID. The CDC defines it as symptoms that begin a month after infection, whereas the World Health Organization describes it as anything that lasts at least 2 months.
I can see why that would be confusing. Is there anything else that could explain the symptoms in COVID-negative kids, if not COVID itself?
Yes. Researchers suspect that the kids in the control groups might have simply been suffering from other respiratory viruses. But another possibility is the pandemic school shutdowns and other societal changes could be causing all sorts of physical symptoms. Another study in the UK found that a whopping 40% of children, including those who'd had COVID recently and those who hadn't, reported feeling worried, sad, or unhappy.
That's pretty sobering. But stepping back, how worried should parents be about long COVID itself?
The findings suggest that long COVID isn't a huge risk to kids, but it can still be a real struggle for those who do develop it. And other research has shown that kids who've had COVID are at a higher risk of complications like diabetes and heart problems than kids who've never been infected. Scientists still have a lot to learn about long COVID, both kids and adults. But some of these findings can at least provide some indication that it may not be as common as some had feared.
OK， 他讲说要让小孩去学习，因为要开学，所以要让小孩去学校，那会面临到什么风险？第一个就是说他们在讲问题，在讨论问题。第一个就是疫苗的施打率，然后第二个就是说什么确诊率，然后第三个，然后等一下，哪里？等一下我想，反正就是讲了很多，然后后来还有说那个长新冠对于小朋友来说有没有影响？然后因为他们就是有做实验，就去调查，所以他们发现说，其实在那些感冒症状或者什么的下，其实是没有影响到太远的。但是有个问题就是说，我是从确诊完之后的1个礼拜，还是说1个月？就是看它时间的不同，然后持续的时间的长度也会有对于这个实验有影响。然后后来有说到说，因为学校关起来或者什么很多原因，造成说他们生理上的比较受到影响，像是什么忧郁啊，心情低落啊 ，depression，因为这是有没有得 COVID 都是没有关，因为都关在家里，所以这也是一个问题，他说需要被注意到的。对，差不多是这样。这真的要 take。
第一个他大致上分为讲2个，第一个是在讲他们关于开放学校的事情，他们在讨论说开放学校，他们开放学校的时候，有时候会有一些问题，像是说小孩还没有完整的 shot 那个打 vaccine， 然后所以呢，也就是生成的第2个问题，就是他们需要很多的快筛或者是 PCR， 所以他们在决定说华盛顿白宫那里就决定说要准备多一点的快筛跟 PCR， 他们说每2个各设600 million， 我懒得换算，然后再来第2个，他讲的是 long COVID。他们说 long COVID 的呢，大部分的 children 在6天以内的时候就会好转， 好转啊。但是他们还说有一些东西还是必须要去考虑的，像是有些小孩他们会得 long COVID 之后呢，会有心脏的问题啊，或者是说一些问题，这些都是值得去讨论的。